I'm Jordan Lulich. This is the Lulich Corner, and today I get to sit down from Rick Hall from Multi-Care Medical. So Rick, first off, thank you so much for coming in, taking your time to sit down with us and really share about what you do and how we work together to help people that are going through some type of injury or some type of accident. So before we really dive into some questions and get started on what we're going to talk about today, I'd love for you just to introduce yourself to the audience and share a little bit about Multi-Care Medical.
Sure. So my name's Rick Hall. I'm a physician assistant. I originally started out in emergency medicine. So I've practiced emergency medicine for about 30 years. But one of the things I recognized from emergency medicine was, we see a lot of trauma victims and patients after car accidents. And one of the things from an emergency standpoint I really needed was adequate follow-up and good, after incident care for my patients. So I established a relationship with the owners of Multi-Care Medical when I was actually working in Fort Myers. And then when I moved to Vero Beach about 4 years ago, I recognized they didn't have anything like that. And so I reached out to them and we communicated some, and they were like, absolutely, we're going to open a clinic. And we established Multi-Care Medical in about 2021, when COVID was kind of still occurring. And we developed the clinic, and we've actually grown quite a bit over the course of the last 3 years. But it's been a great relationship, and I've actually left the emergency room now, and I work in Multi-Care Medical as my, I work there, I'm kind of semi-retired. Okay. So I work there on Mondays and Wednesdays, and we have a chiropractor there as well on Tuesdays, Thursdays, and Fridays.
Great.
But it's really nice from an emergency standpoint to be able to manage my patients now and help them improve.
Rather than for them just, not seeing them afterwards.
Right.
So, I think one of the first things that I wanted to dive into a little bit is, for people who get into an accident, why is it important to seek medical attention? And, I know a lot of times, even like, you get involved in an accident. I've been in a few accidents myself. Adrenaline's pumping. Right. You got a lot of anxiety. Right. And a lot of times, your immediate reaction is, hey, I'm not injured. Like, I'm good. Like, I'm okay.
Right.
Why, whether you're injured or maybe if you don't realize that, you're not feeling any symptoms or having any injuries, why is going to a medical provider like someone like yourself, why is that important to do it after an accident?
Well, like in the emergency room. So patients would come in the emergency room, and a lot of times they'd be like, oh, I'm not really that hurt. And I'd be like, wait until tomorrow or wait until the next day. So what happens is, right after an accident, you're exactly right. They have that adrenaline pumping and all those, all those stimulants. And, they say actually adrenaline's stronger than any pain medicine they've ever come up with.
Wow.
So it's really, really high potent. And what happens is then when that adrenaline wears off and then, all those muscles start to realize that something happened, it's like exercising, except for in a bad way. The next day and the day after that, the pain's much more severe. And so what I always recommend patients, it's really important to follow up with somebody sooner than later, because as soon as you can start non-aggressive therapy, physiotherapy, muscle stimulation, ultrasound, gentle manual therapies, those kind of things, it actually helps you improve faster. So it's not only about just treating the pain, but it's also, and like for me, I just want to get back to my life as fast as possible.
Right.
Really helps them recover faster.
What would you say from a motor vehicle accident? Someone's involved in a car accident, or maybe they're driving a truck and they're involved in a motor vehicle accident. What are the most common type of injuries that you see that arise from an accident?
One most common thing that everybody recognizes is neck pain. The problem is even with a headrest, our heads are pretty mobile. And when you have an acute change in direction like that, it really manipulates our neck. Our neck is pretty fragile. People don't really recognize that, but the neck is pretty fragile anyways. So, and it's not only being rear-ended that you get whiplash injury. Any impact in a car manipulates your head in a direction that is really not supposed to go that fast.
Right.
So that's one of the most common things we see. The other thing is around our neck, we have our trapezium muscle, which is a big diamond-shaped muscle that attaches to the back of our skull, goes across to both our shoulders and into our mid-back. That muscle there tends to go in spasm a lot right after an accident. And a lot of people, what they also develop is tingling down their arms. A lot of people are like, oh my God, I couldn't feel my arms and I felt really weak after the accident. And the thing is to recognize whether that's a problem with a cervical spine injury versus the muscle spasming and triggering the nerve. So a lot of people don't, and as a layperson, I wouldn't know that. Right.
Right.
So oftentimes in the clinic, we get imaging that helps us objectify what the cause of the problems are. So, but neck injuries are very common. Low back and mid back injuries are very common. The other thing is that if you have airbags deployed, airbags are fantastic for the right situation, but for, like if it's not too severe of a motor vehicle accident, the airbags sometimes are more traumatic than the car accident.
Yeah.
And we have a lot of patients that have, trauma to their chest wall, trauma to their abdomen, trauma to the knees, head injuries, those kind of things.
Now, what happens, like these injuries that you're explaining, what happens, if you've got neck pain, back pain, what happens if they go untreated?
Yeah.
If you don't seek medical attention, what's the long-term consequence of that?
Obviously, the first thing is it'll get worse faster. The other thing is, you have to be concerned about cervical spine or nerve impingement that can happen with bulging herniated discs. Once people understand the anatomy of how the neck works, they understand how fragile it is. And the discs between our vertebrae are really our shock absorbers. And so you can get inflammation in there that starts pushing on the nerves. And if they're untreated, what can happen? Muscles and bones kind of recover over time. Nerves don't like that. So if you have an impingement on a nerve and it's prolonged, the damage can be permanent.
Wow.
And that's kind of a really big concern. So you want to make sure that you don't have any kind of nerve impingement. Because what will happen is, if you've ever heard of drop foot from people that have back injuries, what happens is the sciatic nerve, or the nerve affecting the leg, has been encroached upon for so long that they lose that motor function in their foot.
Yeah.
And even if you have surgery to repair it, you don't ever recover that nerve function.
So some pretty large consequences.
Absolutely.
One of the things that people might feel intimidated going to seek medical attention, I know, especially for something like a substantial or like a big injury from a car accident, people are not used to seeing doctors regularly. And to kind of set expectations, what can they expect, at their visit? Like kind of walk them through what that experience is like for a visit coming out of a car accident.
One thing I recommend people to be seen in an emergency room if they have significant injury. If it's really, really minor, that's fine. Set up an appointment with us. But emergency care, if you have severe symptoms, I think that's important. The other thing, when they come to our clinic, the first thing that they get is a medical evaluation. So we'll assess them. Again, I have 30 years emergency experience, so I've seen anything you can imagine. I've seen it twice.
I'm sure.
Right. So
that's a long time in the emergency room.
That's a long time. But, to get a proper medical evaluation to determine the severity of the injuries, And then the other thing is so then when they come to meet me, we start with a medical evaluation, then we begin them on treatment as soon as possible. The idea is to get, like the gentle kind of non-invasive treatments going as soon as possible. Muscle stimulator to get those muscles kind of working, to get the blood flowing through there. Ultrasound to generate some deep heat in there. Massage to help the muscles relax. If they didn't get a prescription for anti-inflammatories and muscle relaxant, I think that's important. A lot of people don't like anti-inflammatories. They're like, I don't take pills. And I was like, I get that. I'm not a big pill guy. However, what I am, I'm healthy and I'm in good shape. And if I have an injury, I want to treat the underlying problem so I can get back to me fast as possible. So it's when you take an anti-inflammatory, you're not taking it to disguise the symptoms. You're actually helping treat the problem. So those are the things that we look at, and then we get them started on treatment. If I feel that they need imaging, such as MRIs and those kind of things to objectify the injury, then we get those orders and get those done. And then in our clinic, over the course of time, initially we begin to treat them with those forms of therapy to try to get those muscles to improve, to get the inflammatory response down, to get them healing. And then over the course of time, I always tell people that it's probably 6 to 8 weeks before we figure out where you're going to be with discomfort. And a lot of people are frustrated because they were like, you know what, Rick, I was working in my yard and doing everything I wanted to do before the accident, and now I can't do those things.
Yeah.
And so in a perfect world, we get them back to being that happy person again. However, if after 6 to 8 weeks, they're still having significant discomfort, MRI shows that they've got some bulging herniated disc that's impinging on things, we have the opportunity to refer them to a pain management that can,
For more invasive.
prednisone injection, which I think is phenomenal in limited uses.
Right.
And then ultimately surgery, if that's down the road that they just have something that's significant. But the first thing is to get them in there, get them treated, and get them better.
One of the things that we see a lot is we see after an accident, we see, before our firm's hired to represent them in their personal injury claim, we see clients and patients, they go to their primary doctor. Yeah. And that's kind of their first go-to.
Right.
Why is it important to specifically go to a facility that has experience with treating people that are going through these types of motor vehicle accidents rather than going to a primary physician?
Right. One issue, and this was the biggest issue that I ran into the emergency room, was when you refer a patient back to their primary doctor, a lot of times the primary doctors go, I won't see you. Right. Because we don't bill to insurance, to auto insurance. And so, and then the patients are frustrated because they can't get the care. Right. Even a lot of the orthopedic offices, I've had patients that have fractures and they've been referred to ortho, and ortho's like, we don't do car accidents. So that's a frustrating thing for the patient, first off. The other thing is like, that's going, like if you have a kidney problem, going to your primary doctor. Well, if I know I have a kidney problem, I'm going to go to a kidney doctor. So Multicare Medical, we take care of car accidents. I know exactly what's going on. I've seen it 1,000 times, in the emergency room. So I can properly and adequately treat you. So that's why I think it's important to go to the person that's specializing in the treatment.
You're not going to go to a heart surgeon to get a knee surgery. Right. Yeah, exactly. I agree with you 100%. Yeah. And that's a great point as far as the primary physician goes that you made. They may not take that because ultimately you're billing your auto insurance to pay for the visit, and primary physicians may not just be set up to be able to bill that. As we kind of wrap things up, what just advice would you give to someone who's been involved in an accident?
Yeah. The first thing is seek medical care, because again, you might feel great, but if you've worked out hard, the next day and the day after, you're going to be really hurting. And I always tell people, treatment sooner than later is always the best thing. Yeah. Again, and the other thing is just go get checked out, by somebody like us, because we know kind of what we're dealing with and what you're dealing with. And then we can help you kind of and guide you as to, I think you're going to be fine. Or no, this is really severe. You need to continue treatment for a course of time, or you need these other image studies. So I really think that it's important to seek help as soon as possible. Don't be afraid to ask for help. Yeah. The other thing is, as far as attorneys, and we appreciate our relationship with you guys, I always tell the patients, the problems with car accidents is navigating the insurance and all that other kind of stuff is really a disaster. And, I'll use the analogy of medicine. My mom had a major stroke and I practice medicine. I've been doing it for forever. I know the ins and outs of taking care of patients. But when my mom needed stuff with the insurance and the billing and like which facility, I was clueless, clueless. It ended up costing me a lot of money because I didn't understand the process. Right. So, I think attorneys are really beneficial in facilitating the logistics of the insurance.
Yeah, absolutely. I mean, insurance companies, they're the largest corporations in the United States. And so, we pay all this money to insurance. We think we're paying it to protect us. But, the insurance companies, they're looking for a reason not to give anybody a penny. Right. So people don't really realize that. So having that attorney who really levels the playing field and can go and advocate and negotiate on behalf of a person who gets involved in an accident, really, at least from a leveling field, really levels out that field for them. So
because it's business to them.
Yeah, it is business. The insurance companies, their motto is to pay nothing, or if they're going to pay something, to pay as little as possible. Right. So having that attorney who can go and advocate for you really, really is, I think, critical, because insurance companies, they know if they're dealing with someone directly, they're going to take advantage of that from a negotiation perspective. Right. But as we wrap up everything, I'm sure people might want to reach out to you. So I appreciate you coming on and really sharing your wisdom and your thoughts. But Rick, how can people reach out to you if they want to learn more, or if they have any questions, or if they want to come and see you or your clinic?
The address for Multicare Medical is 880 37th Place, Suite 105. Here in Vero Beach. And we're actually the street that's right across the street from Cleveland Clinic Hospital. Okay. That's where we're actually at. So people can come and see us there anytime that they want to. The other thing is, I'll get you our phone number, 772-227-1368.
Well, Rick, thank you so much for coming on. Thank you for joining us. I'm Jordan Lulich. This is the Lulich Corner, and we'll see you next time. Thank you.